Uh, this is a second webinar we wanted to do. We're going to make this sort of a regular thing. My name is Dr. Eric Aiken. I'm accompanied by my partner and colleague, Derek Henderson. And we're here because we have come across something. We discovered something that really transformed our lives, our health, and thereby improved the quality of our lives pretty dramatically. And we just want to introduce this to you. And in doing this, here I'm going to share this. This is our promise to you in this short presentation. Hopefully here we go. In this short presentation, here is our promise to you, is that you're going to learn how to achieve supreme health. And by that, I mean normal body weight, normal blood pressure, optimal cholesterol profile, and optimal metabolic flexibility, and a few other things you're going to discover without feeling like you're giving something up. And that's a very important thing, because a lot of people got some methods to show you, but it's like training for the Olympics, or it's like, starving yourself. And this it doesn't have to be like that. And so one thing to keep in mind, and here's the central feature to this, what we're about to show you, is the problem isn't your matter of willpower, and it's not your genetics. It is insulin resistance. And if you solve this one problem, insulin resistance, then you can solve all of the others. So keep this one thing in mind. Stay to the end. We got something for you. Derek, why don't you tell them what this is?
Yeah, this is the lab cheat sheet and how to decode your metabolic health. Dr. Aiken, who introduced me to this, talks about the five most important lab for supreme health. The biggest one being your fasting insulin levels, which most doctors don't check, as it says there. And it shows you, this cheat sheet will show you how to interpret them for yourself so you can take control of your health.
Okay. So we'll show you how to get that at the very end. But first, before we get started, I want to tell you a brief story. And so a few weekends ago, I was at a hospital. I take call every other weekend at a large medical center. And this is a typical weekend at this facility. But I saw 6 patients who had strokes, all 6 of them. Every one of these patients was under the age of 60. One of them was under the age of 50. Now, when they call a neurosurgeon to see a stroke patient, there's 2 kinds of strokes: bleeding strokes and ischemic strokes. These were all ischemic. That means they lost blood flow to a portion of their brain, and that portion of the brain dies. That will cause swelling in the brain. Now, if it's a large area of the brain they lost blood flow to, the brain can swell so much that it can take your life. That's when they call a neurosurgeon, typically, and sometimes we have to do a procedure, an operation in which we remove a portion of the skull to allow that swelling to happen so it doesn't take their life. If the pressure gets too high in the head, it can be a life-ending event. But if you take that skull away for a while, until the swelling passes, well, you can actually preserve some of the function. But every one of these patients, at some point, I know, thought to themselves, I really need to make some changes in my behavior, my habits. I need to get ahead of this. And now it's too late. And that look on their face when they realize that this has gone seriously too far, and that they are not going to be able to undo this. You don't want to wait until you've had a health scare or a health disaster to get ahead of this. And you don't have to. It doesn't have to be hard. And that's the main point that I want to make with you in this. It doesn't have to be hard. 88% of our population right now, though, is metabolically sick. So those of you watching, there's almost a 9 out of 10 chance that you are in that category and you need to do something about it. So why listen to us? Who are we? Well, I'm a career neurosurgeon, and this is me. This is what I looked like at home. Usually when I was in residency, I was normally asleep, because back then they didn't have the work hour restrictions. And I came from a medical family. This is my father, a general surgeon. And I have been an online health coach for now 8 years. I've been asked to be on podcasts all over the world, and I speak at the collegiate level for corporate wellness programs. And I've been asked to be a speaker, or I was a speaker at the last Quit Sugar Summit, the 12th annual, alongside people like Robert Lustig. And both Derek and I have Dr. Ben Bigman. If you're a metabolic health nerd, you will know who Ben Bigman is, but he is one of our colleagues in this business. And so, Derek, tell them a little bit about yourself as well.
Yeah, so I'm an ex-professional baseball player, and a lot of people think professional athletes are the epitome of health. Well, Dr. Akin actually asked me a simple question when I came in to bring his office lunch about insulin resistance, and I knew nothing about it. I was suffering from cholesterol and low testosterone issues, and I blamed it on old age. And that's where I come from. And once I retired in 2004, I became a professional medical device salesman, and that's how I met Dr. Akin, because he used to implant my spinal cord stimulators for chronic pain. And again, walking in one day, be able to talk to him about metabolic health changed my life, because I didn't want to be put on medication. I always looked at myself as being healthy, but having cholesterol issues, high cholesterol issues, and low testosterone issues, you're not healthy. You just got to learn how to address it. And that's why I'm here.
Yeah. And so Derek and I both were exposed to, the aftermath of it. Once we sort of became cognizant of how important metabolic health is and the effects on your health with ignoring your metabolic health, we realized we were making the connection of what we were doing together in the operating room. So Derek sold a spinal cord stimulator device, and the people we were implanting these into were people with, peripheral neuropathies. Their nerves are damaged and now causing them pain because of that damage. And that's why we were putting this device into their body in order to help control that pain. Or they had spinal degeneration. Again, a lot of spine degeneration is caused from poor metabolic health, not from that accident, that fall that you had when you were 18. Very little of that is from previous trauma. Most of it is from how you've been eating for the last 20 or 30 years. And so a lot of these people were diabetic and, were more prone to complications. And yet we were having to put these very expensive devices into them in order to control their pain. So this is why listen to us. Now, that's enough about us. Now about you. I want you to imagine something. If we had some information for you, that if you were to follow this information, that in just a few months from now, if you're taking diabetes medicine, you might have to start cutting back on that medicine, or you might not have to take it at all. That you go into your doctor's office and you've been on a cholesterol medicine and your doctor's smiling at you, but he's looking at you confused and he's like, hey, I don't know what you've been doing, but I don't think you need this cholesterol medicine anymore. And whatever you're doing, just keep doing it. Or you have to go to the mall to get new clothes, not because your old ones are too small, but because they're too big. They look like you're wearing garbage bags on you, that you've gotten so lean. Your friends are asking you, what's up? You look great. What are you doing? I want to know. Well, that could happen if you listen, but more importantly, if you act on what we tell you here in just a few minutes. So we're going to give you a few secrets about how to make this happen, how to improve your metabolic health, which will improve your energy. It'll improve your labs. It's going to improve the way you look, and most importantly, the way you feel. So here's the first secret. It's not your genetics. You're not doomed to your genetics. I don't care what your parents went through. This is my genetics right here. This is my father. Here's the way he looked at 30. This is the way he looked at almost 60. Now, here he's overweight. He's got high blood pressure. He's got type 2 diabetes. And he was only going to have about 4 or 5 more beyond this picture. And after this picture, so 6 years later, his life started getting really bad and really miserable for a long time until it took his life. That's my genetics. but I was able to overcome that. I'm nearly the same age he was in this picture right here now. And yet I'm not on any medicines. Here in this picture, he was taking a diuretic, another blood pressure medicine. He was taking diabetes medication, a cholesterol medicine, all these meds. And here I am at nearly the same age and I'm on nothing. So how do you overcome your genetics? They're only 10% of the game and you can easily overcome that 10%. Here's a few things to consider. Ultra processed food. First of all, what is it? If you don't know what ultra processed food is, you need to go look it up. There's plenty of information. I'm not going to teach you that in this talk right here, but find out what ultra processed food means. And then are you eating it? Because that's going to contribute to the problem. Then do you have insulin resistance? Most people that are suffering from chronic disease, they're pre-diabetic or they have insulin resistance, which doesn't necessarily show up on your routine labs. You need to know, are you insulin resistant? What about your environment? Are you setting it up? Most of your behaviors are on the subconscious level and they are affected by your environment. If you don't set your environment up right, you're at the mercy of your subconscious. You're going to do the wrong thing every time. So how do you set the environment up? You need to figure that out. And we can show you that more. I have a private group called the Thrive Society where I teach this kind of stuff here. Stress, sleep. Are you addressing these? Sedentary lifestyle. Are you taking 15-minute walks within 15 minutes of every meal that you eat? That one action right there, a stroll, a casual stroll for 15 minutes within 15 minutes of a meal cuts your risk of chronic disease by 50%. And then what medicines are you on? Certain medicines like cholesterol medicines will actually increase your risk of becoming insulin resistant. Again, I told you, insulin resistance is the key. If you reverse that, you reverse your risk for a lot of other stuff. So when I did this, I was following in his footsteps. But when I started figuring out the right things that I needed to do and got a little help from a natural supplement system, that was the key to all this. Suddenly I'm here and I'm now in the top 5% in terms of being in metabolic health at my age. So Derek, you take secret number 2.
Yeah. Secret number 2 is controlling your hunger, sugar cravings, overeating. It's a matter of hormones. When your insulin levels are high, your body is craving sugar. Again, I mentioned earlier, one of the secrets that we talked about, obviously, was insulin. That secret is that they don't test for high insulin levels. Dr. Akin has has been speaking about that. You got to lower it, and we're going to teach you about how to do that. Control your hunger. Control your insulin levels. You control your hunger. And then,
if you want to go over this one, you want me to skip this one?
Yeah, you can skip through that one.
All right. This is Jackie Lackey. This is one of our colleagues in the business. Jackie was one of these people who figured out, for the longest time, she was trying to lose the weight. She couldn't get the weight off. No matter what she did, she couldn't figure it out. She wasn't checking the right labs. Once she finally started checking the labs that actually tell you whether or not you are insulin resistant, suddenly she drops 100 pounds. It is a complete transformation. She's one of thousands that have done just what Derek and I have done to achieve this very same thing. Now, secret number 3, being healthy saves more money than it costs. A lot of people say that they can't afford to eat healthy, but there was a study out by Harvard University that showed that actually it does not have to cost you more money to eat healthy. But here's some things to keep in mind. There's a financial incentive for you to think about this. If you are overweight, people with obesity earn on average 5 to 15% less income. It's not fair. It's not right, but it's that way. Our society and pretty much most of the world society discriminate against people who are overweight. Even people who are overweight discriminate against people who are overweight as their employees. People who are overweight and who have metabolic syndrome have higher absenteeism. They miss more work. They are less productive at work, which is another reason why it's hard to be productive when you're sick. You will pay higher insurance premiums, more out-of-pocket costs for labs, doctor visits, and medications, more frequent ER visits and urgent care. And it raises your risk for long-term disability up to 90%. Now, there are charts that you can find, calculators online, that will show you what your risk is for becoming disabled for more than 5 years. Imagine that you could not work for 5 years. What would happen to you financially? And if you're raising your risk up to 90% for that happening, I mean, you need to you don't just, it's not necessarily having a major health crisis or expiring from your health problems. It's going broke long before those things happen. So when people become disabled, it affects women more than men. They lose 5 to 11 years from a health episode that causes them to be disabled versus men that lose 4 to 8.7 years. So it is more expensive to neglect your metabolic health than it is to invest in your health. Believe me. So the solution we have, Derek, you can introduce them to this.
This system has literally changed my life. It's called the Feel Great System. Dr. Akin introduced this to me, and I'm so proud and happy about it because what it is, it's about lowering insulin levels. He spoke about chronic illnesses. It's not a weight loss program. It's not a diabetic, it's not metformin. This is a insulin lowering protocol, and this is how we do it. The two tools we use, one called Unamante. It's a yerba mate extract that is cultivated in South America. And it helps you to forget about food. Skipping breakfast is part of that because, as we know, breakfast is supposed to be the most important meal. That is not true. What's in that Unamante is chlorogenic acid. It increases GLP-1 by 60%. Glucagon-like peptide that's already in your gut raises it up, helps you to forget about food. It's an amazing thing. Increases ketone production by 70%. Ketosis is where your body is constantly burning fat. That's why protein diets work. It also has anti-cancer properties. There's neuroprotection, protects your kidneys, lowers inflammation. Inflammation is the root cause of most of our problems. Chronic pain is what I used to sell a device for. That's a problem. The second part about that is the balance. The balance is the special fiber that it does all 5 of those things that you see there. You're looking at one for the top one. Lowers my cholesterol. My triglycerides went from 111 to 72. Lowers blood glucose levels because it coats your gut and prevents glucose spikes. Improves gut health because of the soluble fiber that's in it. And it helps to remove toxins from your body. Improves satiety, which means you don't overeat. Give your pancreas a break from producing insulin, as we spoke about earlier, and again, lowers inflammation.
So both of these products have been listed now in the PDR, the physician's desk reference. This is it's the most trusted, and it's the guide that doctors use the most in order to look up drugs. And even though these are not pharmaceuticals, they have a pharmaceutical level effect and without all the side effects. They have been studied by the #1 heart hospital in the United States and actually in the world, the Cleveland Clinic. And what they found is that these products, especially the Balance, can be an alternative to taking a lipid-lowering drug like a statin, or it could at least reduce your dose for those medications. Many people have side effects on statins, particularly the muscle pain, muscle aching, and this can help just lower that cholesterol without you having to take those kind of drugs. I will briefly go over some of the ingredients and Balance. They have some patented mixes. You cannot get these anywhere else. There's no other substitute. There's no other cheap version of this a knockoff that you can get. These are patented blends, and the quality of fiber that you're going to get in that mix is unparalleled. And so this is why you don't see it on the GNC shelves. This is a premium product. And then the phytonutrients here, he mentioned the importance of inflammation. Your cholesterol, even if it's elevated, is not a problem to you necessarily if you don't have inflammation. You got to think of it like this. Let's just say you've got an LDL-P that's 116. You know, they keep telling you want it under 100. Some even say get it under 70. But let's just say it's 116. That's like having gasoline flooding your basement in your house. There's gasoline there, and you got a little book of matches on the bookshelf down there, and it's lit. Well, that's a problem. You don't want that match to hit the gasoline. It's going to burn your whole house up. But if you extinguish the book of matches, the inflammation, there's no risk. You can have all the gasoline in the world in there. It's not going to matter if there's no match. And that's what this does, is it extinguishes the match and it takes away the risk that your cholesterol poses to you. Cholesterol does not become toxic to you lest you have inflammation. This is why all the controversy around cholesterol. And just a little note to those of you who are outside the medical business industry, whenever there's a huge controversy going on in medicine about a particular topic, that means that something's about to change. The old guard wants to go with the old idea, but there's a new concept coming along, and it's a process to get people to buy into or to understand the new process or the new paradigm. And that's what's happening with cholesterol. It appears, at least on the surface, that money had a lot to do with what we're doing right now and how we think about cholesterol, but money tends to skew the truth. It's a bad influence on the truth. And so now we have a special offer for you on this product, on this system that is changing lives here. And again, you get on this system, you can start eliminating a lot of your need for the other medicines you take, the blood pressure medicine, the cholesterol medicine, your diabetes medicine or insulin, your erectile dysfunction medicine, your polycystic ovarian syndrome medicines, and the medicines you're taking to try to get pregnant because you can't get pregnant because of PCOS, and a whole lot of other things. And you can avoid your risk for Alzheimer's, preserve your cognitive function. So you're not the old grandma at Christmas that can't keep up with a conversation. Nobody wants to talk to you because it's too difficult. You can hang on to that until the end of your days. Your brain doesn't have to go bad. Okay. So to entice you, to make this worth your time, I'm going to give you a lot of extra value. You're not just going to get this system. I'm going to give you this lab cheat sheet for free. These are the labs your doctor doesn't check on you routinely, but you need to have checked on you at least a couple of times a year to know if you're metabolically healthy. And many of your doctors wouldn't even know what to do with the information if they did it, but this is going to show you what the numbers mean so you can interpret it for yourself. We're also going to give you the metabolic reset protocol. This is not a diet. It is an eating framework so that no matter what style of food you like, Mexican, Brazilian, Chinese, whatever, it's a framework that you can operate within in order to achieve metabolically what you need to achieve for your body to stay healthy. Finally, you're going to get the apps and wearable technology guide. This is a curated list of apps and wearable technology that I think actually are helpful. There's a lot of stuff out there that's kind of gimmicky and doesn't work. This is stuff that has real science behind it that I think will help you. You're going to get all three of these guides for free with your subscription to the Feel Great system today. With your subscription, I strongly suggest that you do the 3-month trial. That's why I think it's so important to be on the subscription rather than just a one-time buy. I think I just lost Derek, but he'll be back. But then you're also going to get coaching calls. You'll get free coaching calls with me, 3 of them, and we'll set up a schedule so that we can tailor your results for what you are trying to specifically achieve. You're going to get a 30% permanent discount on this nutraceutical system with my link or with Derek's link. You're going to get a 90-day money back guarantee. So that means you can try this system for 3 months and still get your money back. And by the way, you can keep the guides. You'll get the free coaching and all that. It doesn't matter, but you can still get your money back. So it's no risk, but you're getting a lot of value for this. So again, with your subscription today, not a one-time purchase. By the way, you also get an extra discount when you do a subscription rather than a one-time purchase. You're going to get the 3 guides. You're going to get the free coaching, a 30% permanent discount, and a 90-day money-back guarantee, all just for your subscription today. So when you do this, you will eliminate your risk for a lot of problems. These are all of the things that are tied in to insulin resistance. Here's the biggie: heart disease, the #1 killer of humans. Type 2 diabetes. This is affecting so many people right now. And again, my father basically expired from complications of this. You do not want this, but it's completely reversible. Alzheimer's, again, a top 10 killer, kidney disease, stroke, but you reduce your risk for serious things, cancer, sleep apnea. A lot of people don't realize sleep apnea causes heart problems. That's the big risk behind sleep apnea. It's a silent killer. Non-alcoholic fatty liver disease. There's 4 organs in your body you got to have to live: liver, heart, lungs, and brain. Only these must remain. And that was the surgeon's credo. If in doubt, cut it out. So you got to have your liver. And if you've got insulin resistance, you are absolutely demolishing your liver. High blood pressure, huge problem. So all of that gets better on this system. So what's more expensive? $5 a day on this system, or thousands in premiums on your insurance, medications, missed income, lower wages, just feeling bad? You know, what is feeling good worth? Is it worth $5 a day? And this only takes a few seconds. This is the bottle right here. You put it here. Here's the tea right here. You fill it to the line. You pour it in, you shake it up, and you drink it. It's that simple. It's very quick. Same thing with the balance. You fill it to a lower line on this same bottle, pour it in, shake it up, and drink it right before your biggest meal of the day, the one that's going to contain the most carbs. That takes you seconds out of your day to do this. Here's the kind of results we've been seeing with this. These are some of the people who've been on this system, and there's thousands more. These are just some of the people who are willing to share their before and afters with us. But some of these, and not everybody had weight loss as a goal. This gentleman here had been a type 2 diabetic for almost 3 decades. He is no longer a diabetic, period. This gentleman here had every chronic disease known to mankind. He weighed almost 1/4 of a ton. He was on 24 medications. Now, even though he's still morbidly obese, he's lost over 120 pounds. And even though he's still morbidly obese, he's only on 3 medicines. That just goes to show you the medicines don't keep you alive. Okay. They're not going to reverse the disease. If he was on 24 medicines and still sick and looking like this, he goes on this natural system. Suddenly he's on 3 medicines and he's starting to shave the extra weight off dramatically. Imagine you doing what we're telling you right now, subscribing to this. In just a few weeks later, you notice your hunger is just not like it was before. You're not having to get up in the middle of the night and hit the pantry. You got control over what you eat when you go to the restaurants. You start having to buy those smaller clothes. Your friends are asking you what's happening. Your doctor says, keep doing whatever you're doing. It's working. So for those of you that stay till the end, you can get the free lab cheat sheet if you email Derek at derek.henderson@hindupro.net. Okay, I'll leave this up for a second, but just email him there. He will send you the free lab cheat sheet. But I strongly encourage you, if you're watching the replay on this, then all you have to do is click the link that's going to be in the caption above this, so that you can just go into Derek's website there. You can learn more about the system. You can subscribe to it, and you can get that 30% discount through Derek's link. And just give it the 3-month trial. You can do this totally risk-free. There's absolutely everything to gain and nothing to lose. So we appreciate your time on this. Again, email Derek for the free guide, and we hope to see your name